Good morning, everyone, and thank you for joining. This is Beth Schlachter. I'm Executive Director at FB 2020, and I'm joined by a number of my colleagues here on the Secretariat, and we want to thank you for joining us for a briefing on our activities since the summer, since the summit in London and through the fall, and then we'll give a look ahead to the last of this year and into 2018. So we hope this will be an informative discussion, and we booked this originally as an hour, but we added an extra half an hour on in case there are a lot of questions. Sometimes the conversation part of it wants to run its course, so we're happy to stay if we need that time, but we'll try to wrap this up within an hour to be respectful of your time. I'm going to turn this over to my colleague, Rocky Bishnoi, who's going to share some housekeeping points.
Hello, everyone. Thank you for joining us today. Before we get started, I'd just like to take you through a few logistical notes regarding the webinar. In the screen, you should be seeing a presentation to your left, and then 3 pods to your right, one with attendees, one where you can submit your questions, and the third, a chat pod. Please feel free to submit your questions through the question and answer pod or through the chat pod, and we would be happy to answer those during the question and answer portion of the discussion. And if you have any technical difficulties and would like to email us directly, please email us at info@familyplanning2020.org. Thank you again, and back to you, Beth.
Thanks, Rati. So in today's discussion, we wanted to, again, provide you an overview with key outcomes of the July Family Planning Summit and on our main activities as we head into the end of the year. So specifically, I'll be giving you a readout of the reference group meeting that we held in Abuja the week before last. And there were a number of associated meetings and convenings along with that. And I'll turn it over to my colleagues from the Country Support and Global Advocacy Youth and Portfolios to discuss our upcoming Anglophone Africa regional meetings, as well as recent changes here at the Secretariat to engage more deeply with civil society. And lastly, we'll end our meeting by showing you 2 new resources that we hope will be useful tools for you. The first is our country action plans for acceleration. I know there have been a lot of questions since we introduced these in 2016, and this has been an evolving sort of an iterative process. So happy to share with you where that process is now. And we'll also be sharing a recently launched web resource on adolescence, youth, and family planning. Again, we'll have time for Q&A, and we can stay longer if needed. So we'll jump right into it. In July, we marked an important moment for our community with the Global Family Planning Summit. And for me, I think what was most exciting about the summit was passion, the momentum, the spirit of partnership, and the commitment to solving persistent challenges in our sector that was displayed across the community. There's no hiding from the fact that this has been a difficult year. There have been important changes here in the U.S. with the political system in terms of its impact on global SRHR. We've seen that globally. There's been a lot of pushback. We sadly lost Dr. Babatunde Oshotumen in a way I think that resonated across our community. But the summit, I think, was a moment when we could all come together, or as a family planning community family, if you will, to really be together, to look at the work that we're doing, and to recognize the strength that was built in this community over the last 50 years. It's going to carry us forward, that has in the past, weathered different challenges and storms, and that will continue to move us again as we go forward. So for me, it felt as if 2012 was that watershed moment where we came together and decided on a goal. But in 2017, it was more about how we're going to get this work done, what it means to be a community working on a range of issues so that it's not looking at a numeric goal as an end in and of itself, but recognizing that each of those 120 million women and girls are individuals who deserve respectful care and treatment, and that this community is looking at all of the aspects of that in order to ensure that we're delivering on high-quality services as we expand the sector. So we'll be looking at a number of the key outcomes and commitments from the summit by theme in order to sort of take all of that in. We also introduced the concept of what we're calling global goods, which are really the partnerships that this community has had over the years to solve persistent challenges. And a number of those were introduced again during the summit, and we'll be looking at a few of those together. So on the summit outcome itself, we now, as FP 2020, have more than 120 commitment makers and nearly 50 commitment makers who renewed their commitments during the summit itself. FP 2020 now has commitments from 41 of the 69 focus countries, which was very exciting, with South Sudan, Haiti, and Chad joining. So I think we're beginning to see as well some of the countries where the challenges cross from both development to humanitarian sectors. That's always been the case with a number of the countries, but it becomes ever more so. So this idea of the SDGs, of universality, of working everywhere in order to make sure that we're reaching all populations is really is front and center in the country context for those who've recently made commitments. We also we're very happy to welcome new partners from a new sector around corporate commitments. And I know that that's an area where many of your organizations have been working for a long time in order to develop these. What we saw, I think, is the context around healthy workforce that companies in a local context are embracing more explicitly and ensuring that family planning is a part of those commitments. One of the exciting ones there was Twinings Tea, where they committed to providing family planning for 40,000 women and girls in their tea plantation health care centers in Kenya. So that degree of specificity that allows family planning to be seen in the holistic context of reproductive health, I think is a critical area that's opened up more that we'll be looking at as a partnership in terms of how we move forward. We also had the first ever youth-led organizations who made commitments to family planning and to FP 2020 specifically, and my colleague Emily Sullivan will be providing you more details on that as well. And lastly, we were very excited to see so many partner countries having their own satellite events. There were 34 of them in 24 countries that were designed and hosted by partners themselves in order to keep the momentum moving forward in their country context. So by theme, again, one of the exciting aspects of all of this, I think, is seeing a greater degree of specificity. The 2012 commitments were, I think, an opportunity to signal that intention of work that opened up opportunities for the partnership. But in the renewal of commitments, what we're seeing is a greater degree of intentionality, strategic thinking, and specificity that are more aligned with country plans. Many of these commitments themselves were aligned with costed implementation plans, or CIPs, or with country programs. And the summit team, led by the Secretariat, worked a lot with countries to make sure there was a refining process this time around, where we had up to 3 drafts of each of those commitments to ensure that they were pulling in all the aspects of national plans, that they were aligned with the reproductive health care continuum within primary health care context. So it was a different process this time around because we had so much to build on, both in terms of relationships and the plans themselves, that ended up with a different product. And all of these are available on the website. We're still going back to make sure that we've pulled in all of the content from the commitments, but all of this information is available by country on the website, so you can go in and have a look at that. We also, again, looked at the concept of what it means to really leave no one behind, specifically around adolescence. There was a global good that was announced in terms of a partnership of intention where a number of funders are looking to work together to inspire or adolescent-focused programs that they will then consider how they fund as a group. So there won't be a pooled funding mechanism, but rather that they would review ideas and concepts together, see which ones fit within the purview of any particular funder, and ensure that good projects are going forward so we can continue to build the evidence base and reach more adolescents more effectively. Humanitarian, again, remains an important context where we're looking at how it is that we both bridge globally with humanitarian partners to ensure that contraceptives are available in crisis situations. But importantly, we're also talking about preparedness and resiliency within healthcare sectors for countries who are facing or risking some sort of crisis in the future. And as UNFPA often says, it's not a question of if, it's really when. So how are we ensuring within country preparedness context that contraceptives are provided for within that planning structure? And that's an element that we're pulling into our focal point workshops. It was an element of the reference group meeting as well. So it's one I think that's really vibrant. And of course, financing remains a top priority, with both new financing solutions looking at how UNFPA can better bridge their funding cycle, not necessarily the gap, but how the money comes in and how their ordering processes then align with what happens at the countries, and how donors can help to bridge that in a way that allows for more seamless and year-round sort of ordering for contraceptives for country partners. So with that, I will turn to the reference group meeting in Abuja, where, again, it was an important opportunity to honor Dr. Oshotumen. It was because of Babatunde's passion and his partnership with Minister of Health, Isaac Adwale, that the reference group had decided to go to Nigeria. Babatunde had hoped to work across the spring and the summer with country partners to ensure the highest level of political participation. Unfortunately, he wasn't able to do that. Minister Adwale continued that mandate and that charge along with all other partners. And when we came to Nigeria, we started off the week with a meeting with the Vice President, where all of FE 2020's core conveners, including USAID, UNFPA, DFID, and Gates, met with the Vice President as a coordinated team under the FE 2020 umbrella to support Nigeria's family planning program. It was a deeply moving moment of honor to Babatunde, but also to the partnership itself, where in spite of some funding changes, the partnership itself remains central and core to moving us forward. There were also a series of meetings that were held with partners. The NURI partnership that's funded by the Bill and Melinda Gates Foundation held a faith-based convening. They invited our new faith representative on the reference group, Dr. Ragab, to be one of the keynote speakers to that meeting. I spoke there as well, so we were able to bring in the faith perspectives to the reference group meeting through that relationship. There was a day-long civil society forum. There was a youth forum that was organized by our reference group member, Margaret Balaji, in partnership with the Secretariat, where they did a data training on how to strengthen their advocacy using Nigeria-specific data in their context. So that was a really exciting moment as well. And then the reference group meeting was able to look at annual data. We'll talk about data in a moment separately. But we also talked about sort of the way forward at this point, absorbing what happened from the summit, how all of that sort of reorients some of the work that's happening at the Secretariat, and provide some momentum, again, within our sector moving forward. We looked at financing. We talked about how it is that we will bridge from 2018 to 2020 and start the conversation of what the community wants from partnership and how it is that we might consult with one another about the idea of continuing some sort of platform for collaboration and what that might be and what that might look like. And again, we, as always, talked about how it is that there will be funding for these programs moving forward. We will be building out our website with content from that reference group meeting over the next week, where you'll be able to see the agenda, you'll be able to see presentations that were given during that meeting, except for issues that pertain to this year's annual report. This year's report has been a bit delayed because of our regular production cycle didn't align with an earlier reference group meeting. So we've chosen, because of all the work that we have this fall, to launch that report on December 5th. So everything you see on the website from the reference group will be all of the content except for the data that you'll see that comes out in the report later this year. So I'll just stop on this with a quick look ahead to what we have coming down the pike. We have a focal point workshop, which colleagues will share more with you about, that we'll be doing in a week and a half in Malawi with 15 Anglophone Africa countries. We'll be meeting with Francophone countries in the early spring, and then we'll align on how it is that we work with Asia colleagues later in the year. We're due to meet with them around the time of ICFP, but we need to figure out how it is that we use that global convening as a way of working with focal points overall, so we'll be deciding that in the coming months. We do want to share our, I don't even know what the right word is, maybe condolences with RHSC for having to postpone that meeting, and I know John Townsend is on the line and was in Senegal already for that, and maybe other partners are as well. So we look forward to participating in that whenever colleagues there get that rescheduled. Again, we'll launch the progress report here on December 5th, The Ouagadougou Partnership meeting is always exciting. That's coming up in December. And then we will do a reference group meeting again in the spring or early summer of 2018, and we'll share a scheduling of that with you when we know it. And of course, ICFP remains on the horizon. So cornerstone to our work with country partners remains our focal point structure. And as a reminder, we ask every government to designate one focal point for family planning. And then there are 2 donor focal points in every country. That's UNFPA. In most other countries, it is USAID. And in a few places, it's France or DFID or Gates. And Canada is actually the focal point in Indonesia as well. So we're expanding that to have it be the strongest funding partners within any country context. So these focal point workshops are, I think, one of the most exciting and certainly one of the most energizing things that we do here at FB 2020, where we pull partners together to look at their CIPs and to have an opportunity to work together on what their annual work plan is going to be and how they're going to implement it. We also then have technical partners who are with us over the course of the week of these meetings, where we look at data. We have sessions on operationalizing rights and what that means within the context of work plans and programs. We look at the latest evidence for reaching adolescents and youth, tackle some supply chain issues, and now we're talking again about preparedness and risk reduction. Of course, the South-South learning opportunities for these is really incredible, where partners sit across or from countries and talk together about challenges that they're facing, and really building a community of practice within regions of countries who are working on similar issues. So with that, I will turn it over to my colleague Holly Stewart, who is our Senior Manager for Anglophone Africa, and she's going to provide you a brief update on the focal point workshop coming up in a couple of weeks in Malawi. Holly, over to you.
Thank you, Beth. In Anglophone Africa, the first FB 2020 Anglophone Africa Focal Point Workshop was held in Kampala, Uganda last April 2016. And at this workshop, we shared FB 2020's new strategic direction and developed the 2016-2017 country action plans for each commitment-making focused country. In this upcoming regional focal point workshop, we'll explore how country action plans can be revised to further advance the impact of rights-based family planning based on what we've achieved and learned since the last workshop, and these action plans will be better aligned with existing country strategies and plans. This second Anglophone Africa workshop will take place in Lilongwe, the 6th through the 8th of November. All 15 countries' focal point teams will attend the workshop. A postpartum family planning workshop will follow on November 9th with a subset of these countries who attended the 2015 Chiang Mai Postpartum Family Planning Conference, as well as Malawi. And finally, FB 2020 will hold a national civil society forum to strengthen the relationship between the focal points and the civil society organizations in Malawi and support the country's FB 2020 action plan. The objectives of the focal point workshop are threefold: to develop 2018-2019 actions for acceleration plans, which will be aligned, as Beth said, with costed implementation plans or existing country strategies and policies like reproductive health strategies, population policies, and they will lay out a shared working agenda for the focal points, the Secretariat, and the partners. The second objective is to share and exchange knowledge. Technical experts will provide information and be a resource throughout the 3 days of the workshop. They are invited based on the feedback that focal points have provided in a pre-workshop survey. There will be sessions to exchange lessons and ideas and innovations and to identify high-impact practices. And a portion of the agenda will also be dedicated to South-to-South exchange, countries exchanging successes and their challenges. And the third objective, final objective, is to strengthen civil society's voice. All 15 Anglophone Africa countries have identified a civil society focal point. These new civil society focal points will be integrated into the focal point system, and their views will be included during the development of the actions for acceleration.
Thank you, Holly. And thanks as well for including the mention of postpartum family planning that's going to take place that week, because postpartum and post-abortion family planning is an area that's a growing focus for the Secretariat. We've been part of the collaborative effort to expand access to this in this sector in countries where there is a proven gap for this service and where this is an area that the country wants to focus on since early 2015. And that collaborative effort resulted in the JPIGO FP 2020 co-hosted meeting in June of 2015 that you mentioned, and subsequent meetings and efforts with 20 country teams. So building on this momentum, earlier this year we assumed the role of serving as it was a Secretariat for Postpartum Family Planning that's moved over here to our Secretariat, and a key area of focus for this will be building on postpartum and post-abortion support, advocacy, and tracking into our existing country engagement structure and ensuring that they're integrated throughout the continuum of care where it presents an opportunity to meet an unmet service need. So I'd like to invite my colleague Allison Bodenheimer-Gatto to describe the efforts of the Secretariat further and this upcoming PPFP, or Postpartum and Post-Abortion Family Planning Day. So Allison, over to you.
Thank you, Beth. As Beth mentioned, the postpartum and post-abortion family planning portfolio and collaboration is now under the mandate of the Secretariat. These are the 24 focus countries for this